Good afternoon, everybody. Myself, Dr. Nilanjan Pahari, Associate Professor of Calcutta Institute of Pharmaceutical Technology and Allied Health Sciences. Today, I will deliver the lecture related with the serotonin. Serotonin, also known as the 5-HT, the 5-hydroxytryptophan, and that serotonin also under the amine autocoids. Mainly autocoids, that is coming from two words. Auto means autos, and auto, that is means cell, and acos means the remedy. So that is also used for the cell remedy, and that is derived from the varieties of cells from the mammalians as well as the plants. And in case of the other autocoids, that is also the lipid derived autocoids, the platelet activating factor, prostaglandin, leukotrienes, and another autocoids, that is also phospholipid autocoids. That is, the example is the angiotensin as well as the plasma kinase, bradykinin. Then in case of the amine autocoids, serotonin is the example. That is also known as, I already told you, the 5-hydroxytryptophan, and that is the synthesized from the our body amino acid. And not only that, that is also available in the vegetable as well as the plant as well as the fruits. The 3 to 30% are available in the fruits, 3 to 30% mg per kg in the pineapple as well, and in case of as well as the banana, and in case of the vegetable, the tomato as well as the potato, 0.1 to 3% mg per kg are available. Not only that, in our body, in the mammalian cell, mainly, that is also the concentration of the 5-HT also much more in the pineal gland, as well as the 90% are in our body, mainly 90% are available in our intestine. So our that serotonin 5-HT are available in our central nervous system as well as the our intestine, I already told you, and mainly that are responsible for the different type of function like the regulate the moods as well as the appetite, sleep, cognition, involved with the vasoconstriction and the gastrointestinal motility, and mainly that is also very discovered in the year 1940 century as a vasoconstriction substance, and from the two words the serotonin is derived mainly derived from the serum and the toll, and later identified as the 5-hydroxytryptophan, and that is also linked with the mood regulation and the psychiatric disorder in 19th century. The synthesis of serotonin. The serotonin is the beta amino ethyl hydroxyindole, that is mainly synthesized from the body amino acid tryptophan by the hydroxylation by the enzyme tryptophan 5-hydroxylase enzyme. The 5-hydroxytryptophan are formed, and then by the decarboxylation, the 5-hydroxytryptophan decarboxylase enzyme are responsible to form the 5-HT, 5-hydroxytryptophan. After the 5-HT tryptophan formation, that is also degraded by the monoamino oxidase to form the 5-hydroxyindole acetic acid, and some extent it is also degraded by the dehydrogenase to form the 5-hydroxytryptophan. Then I am discussing regarding the different type of serotonin receptor. Mainly there are the 7 type of 5-HT receptor. 5-HT 1, 5:2, 5:3, 5:4, 5:5, 5:6, and 5:7. And furthermore, the 5:1 also classified into 5:1A, 1B, 1D, 1E, and 1F. And that 5:1 are mainly present or available in the reactive nuclei, hippocampus. And in case of the 5:, that are the G protein coupled receptor. And the 5:1 to 5:7, out of the 7 receptor of 5:, the only the 5:3 is the ligand gated ion channel receptor, and except the 5:3 receptor, all are G protein coupled receptor. Not only that, the 5:1 receptor are mainly the inhibitory activity, as well as the 5:3 also give the inhibitory activity. Except these two receptors, other receptors give the excitatory activity. And in case of the 5:1 receptor, that is also the G protein coupled receptor, mainly decrease the cellular level of the cyclic AMP formation, by which the release of calcium ion also inhibited. So it is also give the inhibitory activity. In case of the 5:2 receptor, that is available in the smooth muscle, as well as the cerebral nuclei, as well as it is also basal ganglia, and that 5:2 are mainly give the excitatory activity by increasing the cellular level of the IP3 ionosyl triphosphate and diacylglycerol to the G protein coupled receptor activity. In case of the 5:3 receptor are available in the central nervous system as well as the peripheral nervous system, and that are mainly the give the excitatory activity by entry of the cationic ions, mainly sodium, and the potassium also through the cationic channel, and that is also give the depolarization and give the excitatory activity. And another 5:4 to 5:7 are all are G protein coupled receptor and give the excitatory activity, except the 5:3 receptor. The 5:3 receptor decrease the cellular level of the cyclic AMP, whereas the 5:4 as well as the 5:6, 5:7 all are increase the cellular level of the cyclic AMP, by which the release of the calcium ion with the excitatory activity. And in case of the 5:4, 5, 6, 7, the 7 is some exceptional, and that 7 are mainly responsible for the effect of the behavioral effect, responsible for the behavioral effect, and some cardiac, that is also responsible for the cardiac rhythm. And in case of the 5:4, and that is also mainly responsible for the peristaltic movement as well as the secretion, variety of secretion. So ultimately there is 4, 5, 6, 7 are all are the same action, same category, but exception is the 5:3 are mainly the inhibitory activity. Next one, the different pharmacological action of the serotonin. So on the cardiovascular system, on the large arteries and veins, mainly constricted by the 5:3. And in case of the where the small vessels are there, the microcirculation are there, the 5:3 dilate the arterioles and the constrict the venules, and capillary pressure rises and fluid escape. And in case of the effect of the 5:3, maybe when we are applying the 5:3 injection in the animal, that give the triphasic response, and maybe triphasic response, the blood pressure is first fall, and sharply fall of the blood pressure due to coronary hemoreflex, then brief rise in blood pressure, due to the vasoconstriction and increase the cardiac output, and the prolonged fall in the blood pressure due to the arterial dilation and extravasation of the fluid. Extravasation means that is also the leakage of the blood vessel. Next on the visceral smooth muscle, it is also give the potent stimulation of the gastrointestinal tract and the constriction of the bronchi. And in case of the gland, mainly it is responsible for inhibit the gastric secretion, both the secretion of the acid as well as the pepsin, as well as it is also mainly responsible for the mucus production as well as it is give the ulcer protective activity, because if the acid and pepsin release is inhibited, so that is also mainly, as well as it is also mainly gastric secretion is inhibited and the mucus production also help for the ulcer protective activity. So it is mainly used for the ulcer protective activity. In case of the nerve ending and adrenal medulla, it is also in the afferent nerve ending are activated, causing the tingling and the prickling sensation as well as the pain. Then in the nerve ending and adrenal medulla, 5 is also give the depolarization of the visceral afferent elicit respiratory and the cardiovascular reflex and give the nausea and vomiting. And in case of you know that the 5HT are mainly when the 5HT release, and after that is bind with the 5HT3 receptor. That is also mainly when the 5HT3 receptor is activated, that are mainly responsible for the vomiting. That is also stimulate the nucleus tractor solitarius and the CTJ chemoreceptor trigger zone in the area proxima. And that is also mainly, and another point also there, that is also stimulated the when the 5HT is released and mainly binding the 5HT3 receptor specifically at the time of the radiation as well as the chemotherapy. Mainly that situation are occur, and we are using the drug ondansetron, mainly ganisetron, that is specifically give the antagonist of the 5HT3 receptor. And the respiration, on the respiration, the 5HT also brief stimulation of the respiration and the hyperventilation. And the hyperventilation, that is also the situation of the deep breath and the usual response. And weak platelet aggregator also 5HT are responsible for the weak platelet aggregator. Then pathological role of the serotonin. When the excess serotonin release are mainly responsible for the increase of the temperature, that is also the hyperthermia as well as the agitation as well as the migraine. And when the serotonin secretion is reduced, that is also give the depression, anxiety and irritable bowel syndrome. Next one, there are the different type of drug are affecting the 5-HT 5-hydroxy system. So mainly tryptophan. Actually I already told you tryptophan, from the tryptophan, the amino acid tryptophan, the 5-HT synthesized. So that tryptophan increase the brain 5-HT and produce behavioral agent, and that is also the 5-HT precursor. Which one? The tryptophan. In case of the synthesis inhibitor, parachlorphenylalanine, that is also the selectively inhibit the tryptophan hydroxylase and reduce the 5-HT level in tissue. In case of the uptake inhibitor, when the 5-HT is released from the pre-synaptic node and 85% are reuptake, and so that is also mainly that reuptake is inhibited by the fluoxetine. You know the fluoxetine also as well as the sertraline also SSRI, selective serotonin reuptake inhibitor. So that tricyclic antidepressant inhibit the 5-HT uptake along with the non-adrenaline, some the SSRI like the fluoxetine as well as sertraline, that are also mainly selectively serotonin reuptake. Now, storage inhibitor, the reserpine block the 5-HT uptake into storage granules and causing the depletion of all cell monoamines, and the degradation inhibitor, the monoamino oxidase inhibitor, non-selective monoamino oxidase, the selective monoamino oxidase A inhibitor, the chlorotoluene increase the 5-HT content by the preventing its degradation. And in case the monoamino oxidase inhibitor, tryptophan, cyclopamine, that are also mainly responsible for the inhibition of the degradation of the monoamino oxidase, because the monoamino oxidase are mainly responsible for the degradation of the 5-HT. Then neuronal degradation, 5,6 dihydroxy tryptamine selectively destroys the 5-HT neuron. Then 5-HT agonist. There are so many pharmacological action also may be done by the 5-HT. When the 5-HT is released, that is also bind with the specific 5-HT receptor and give the different type of pharmacological action. So, if we require that type of effect, so we have to use the agonist. That suppose in case of the 5-HT agonist, non-selective 5-HT agonist, D-lysergic acid diethylamide, that are mainly agonistic activity of the 5-HT2A receptor mainly in the ileum, and mainly that is also activate the type of the 5-HT receptor including 5-HT1A as well as 5-HT2A, 2C, 5-HT, 5 to 7, and mainly it is give the psychedelic drug that intensifies thoughts, and mainly that is also give the emotion as well as that is also mainly responsible for the emotion as well as the sensory perception. Adapirons, you know, adapirons also as a anxiolytic drug like the buspirone, and that is also the partial agonist of the 5-HT1A receptor in the brain. Then 8-hydroxy dipropylamino tetraline, that is also selective 5-HT1A agonist. Then sumatriptan and the other triptan drug are mainly selectively the 5-HT1B and the 5-HT1D agonist. And mainly that is also mainly responsible for the treatment of acute migraine attack. In case of the cisapride, that is also give the agonistic activity. Mainly that is also the give the prokinetic activity. It is also mainly increase the GI motility selectively 5-HT4 receptor agonist. Then metachlorophenyl pyrazine, that is also the metabolite of the trazodone, that is also mainly responsible for the antidepressant activity. Then trazodone, that is also found, it is the agonist of the 5-HT1B and 5-HT2A 2C receptor in the brain, and that are mainly responsible for the antidepressant activity that helps to restore the balance of the serotonin in our brain, which is mainly responsible for the antidepressant activity. Then the 5-HT antagonist, cycloheptadine, as well as the methylsulfide, ketanserin, clozapine, risperidone, ondansetron, these are also give the antagonistic effect. Mainly cycloheptadine, you know, that is also block the 5-HT2A receptor, and mainly controlling the intestinal manifestation of the carcinoid and the gastrostomach dumping syndrome. And mainly that are antagonized reaction caused by 5-HT uptake inhibitor like the fluoxetine. And another point also there, that cycloheptadine also antihistaminic drug. We are also using the drug for the motion sickness, as well as we are also using the drug as an anti-allergic, as well as the doctor prescribed for the children as an appetizer, because it is after taking the drug, it is also releasing the food from the stomach. So ultimately that is also responsible for the as a appetizer. It is also increase the appetite. And another point also there, the side effect of the drug is the drowsiness, dry mouth, ataxia and confusion. Then the methylsargine, it is also the antagonist action of 5-HT on smooth muscle, including that of the blood vessel, and it is also potent 5-HT2A and 2C antagonist and non-selective act on the 5-HT1A receptor and used for the migraine prophylaxis. Next, the phytoncerin, it is also selective 5-HT2 receptor blocking property with the action of the 5-HT1, 5-HT3 and the 5-HT4 receptor. And maybe that is also induce the vasoconstriction, the 5-HT induce the vasoconstriction, cellular aggregation and the construction of the airway smooth muscle are the antagonized by not contraction of the guinea pig or the rat stomach. It is not affected in the guinea pig or the rat. Guinea pig or the rat stomach. And clozapine, that is also antipsychotic drug or used as a major tranquilizer, and mainly that is also antagonist the 5-HT2A and 5-HT2C block 2C and inverse agonist activity at the cerebral 5-HT2A or 2C receptor, and it is also effective in the resistance case of schizophrenia. And what is the inverse agonist? Now, inverse agonist also bind with the side of that agonist, but that give the opposite action of the previous agonist. Then risperidone, that is also used as an antipsychotic drug, maybe that is also 5-HT2 antagonistic activity, and that is also maybe responsible for the helping or that is also for the release of or for the treatment of the negative symptoms of the schizophrenia, and it is also produce the extraclinical side effect of the on the slightly higher dose. Then ondansetron, I already told you, that is also the 5-HT3 receptor antagonist and selectively 5-HT3 receptor antagonist and remarkable efficacy in the controlling the nausea and vomiting, and at the time of the maybe the anti-cancer drug therapy as well as the chemotherapy, we can mainly use the gantesetron as well as the ondansetron. Mainly these are the 5-HT3 receptor antagonists. The lastly, I am concluding that the serotonin is essential for the physiological and pathological process. Therapeutic targeting offers treatment for many disorders, and the advances in receptor specific drug promise the targeted therapies. Any queries you ask me? Thank you.